So during COVID-19, what we've noticed with our youth is that there's a sense of feeling a loss of control, feeling stuck. This is a time where none of us have experienced this in our lifetime, typically. Much wiser, older people have gone through things like world wars before, where they've had to cope with extraneous situations. But for us, this is very new and different. So we're trying to find a normal in an abnormal situation. And when you have a loss of control, a loss of sense of safety, and a loss of routine and connection, this really becomes problematic for your average person, and even more so for our young people who are often marginalized and depend on external resources to make up the gaps that healthy, functioning connections will often fill. So some of that can look like a loss of routine can be very impactful on someone's sense of wellness and direction and purpose. So it's about how do we get a sense of purpose back into someone's life in a time where it feels very unsafe, very unpredictable, and long. We have no idea how long this is going to last for. So we need to really help to find a sense of purpose in our day that seems to stretch hour after hour after hour. If we think of a young person who is struggling, it could look like you work really hard if you have anxiety and depression to put some stability into your life. When the stability and the routine and the resources that it takes to kind of get back on your feet and feel a diminished sense of anxiety and depression, and you pull those supports away, it becomes very, very tedious and unbalanced. So, for example, for our young people that really depend on physical exercise, going out for a walk, attending programs and support groups, finding community, like-minded people who can relate to what they're going through, employment, school, all of these things are critical to a healthy sense of functioning. And even our mental health supports, we're very lucky at Covenant House. We have many staff who are here who can support our young people, but externally, a lot of things have had to go virtual. There's an underlying assumption that people have the resources to access virtual supports. A lot of our young people don't have those luxuries, whether it be a phone, whether it be access to privacy, which is huge, so you can have those conversations in private. So for our young people that have anxiety and depression, it's really, really difficult for them to have a sense of direction and safety when their routine, because we work very hard at putting in structure and routine, no longer exists. So some of it is when we go to work, we have a sense of identity and a sense of purpose, and we feel alive and we feel like we're contributing. And when that's pulled away and you're facing 12 hours of like open air, there's nothing more important than getting some routine back into your life, because your anxiety will go down, you'll still have a sense of movement and not feeling stuck, and you won't feel those very uncomfortable barriers that can be very hard in moving forward in life with.